Effect of adolescent pregnancy on the healthcare system and population subgroups. Introduction. The Philippines teenage pregnancy rate has increases by 60% in the year 2000 to 2010. According to the Philippine National Statistic Office, this is very alarming. Teenage pregnancy often occurs between the ages of 15 to 19 years old. Often in this age, the girls are still studying. With early pregnancy, the girls usually have to abandon their education to give birth or raise their child. Education becomes a lesser priority and it's often delayed until they are able to leave the children at home are financially stable. But there are girls who are studying as well as taking care of their child, and there are who we call student mothers. The burden of these girls have doubled as they have to take care of school as well as their child at home. The life of a student mother is no easy feat. They have to judge their time between attending their classes, making the requirements, taking care of their child, and taking care of the house. They become the primary caregiver of their child and care expected to rear their child well. Many of these student mothers also engage in working part-time to help in the financially burdens of both studying and caring for the child, but this become another disadvantage as it takes up time and effort on the part of a student mother. Conceptual framework. The following is both multi-level of life course framework for easy adolescent health and development. The factors shown are highly related but do not completely coincide. So, for example, we know that a caring and communicate adult can buffer a young person who grow up in a violent and abusive environment from its consequence. Conversely, those who grows up with who protected advantage of education and financially occurs can degrade by peer neighbor influence the model first. Identifies the major domains wherein young adolescent development then denotes accepts of those domains that are protective and those that can leave adolescent vulnerable. Although we are process this factor as risk protective, we're fully aware that we are protective in one actual context environment. Behavior monitoring may be implemented of healthy development in another. Statement of the problem of objective of the study. Objective of the study determined the prevention encountered in adolescent pregnancy on the healthcare system of population subgroup terms of oral contraceptive pills, implementation, injectable contraception, injection, male and female condoms, dual protection. If emergency contraction should be used within 5 days and unprotected sex or condom breakdown. Statement of the problem. What factors continue of the increasing problem of teenage pregnancy? How does it problem impact our lives of children? What can be done to decrease the cause of teenage pregnancy? Hypothesis. Majority will be teenage pregnancy as the problem negative in terms of education, achievement, and employment goals. Significance of the study. The purpose of the study is to assess the awareness of learners about prevention of TP through a sexual education program. The study intended to find out whether teenager are aware of the different pregnancy preventive measures, scope and limitation. This paper contributes the understanding of the borders topic. Who is influenced about what within the family? The teenage pregnancy risk seen is younger sister. When older sister had a teenage pregnancy appears based on the injection interaction with that sister of her child. The family environment experiment by the siblings is quite similar, much as of pregnancy risks among teenage daughters of mothers. Bringing child before age 20 seems likely a result from the adverse environment often given an older sister. Teenage pregnancy has greater impact than a mother. Teenage childbearing social modeling may be stronger risk factor of teenage pregnancy than living an adverse environment. Definition of terms. PT, prothrombin time with the time it takes for plasma to clot. Plasma is the liquid pouring of blood. Doctor's typical order and prothrombin time tests the glue of well-clotting medication. Our work is verify there is clotting problem as a part of diagnosis process.
Chapter 2, Review of Related Literature. Sexual and reproductive health and well-being plays a central role in the lives of young adults. Having the ability to plan whether and when to become pregnant, to protect against sexually transmitted infections, and to receive essential medical care during pregnancy. For example, have important effects on young people's lives, including their ability to earn a post-secondary education, ensuring community college students have access to the care, information, and resources they need to take care of their sexual and reproductive health is an important factor in their ability to achieve their educational goals. This report shares findings from Institute of Women's Policy Research, a study of promising practices for providing sexual and reproductive health services to community college students. Based on a scan of efforts to provide community college students with sexual and reproductive health services, interviews with key experts in the fields of higher education and reproductive health, and a literature review, identified the major programs, strategies, challenges, and opportunities related to improving access in community college contexts. The report describes existing gaps in service provisions and highlights a range of practices that can be replicated and scaled up to expand access for community college students. Expectant and parenting youth involved in system of care represent a unique intersection of developmental needs as adolescents, emerging adults, parents, and young people who come into contact with child welfare, justice, and or other human services systems. Addressing these parallel roles and respective developmental needs is necessary to improve the health, well-being, and life outcomes of both the young parents and their children. But expectant and parenting youth experience numerous challenges navigating their transition to adulthood and parenthood, including negative perceptions, expectations, and judgments about them as young parents. This report will provide an overview and critique of research findings about expectant and parenting youth and the stigma associated with young parenthood. It will also discuss 4 strategies to break the stigmatization of expectant and parenting youth, and thereby increase the likelihood of improved outcomes for young parents and their children. The strategies are reframing the cause and outcomes of adolescent, pregnancy, and parenting, amplifying young parents' voices and positive outcomes, supporting dual transitions to adulthood and parenthood, and building young parents' protective factors. School environments provide an opportunity to address health-related topics and ensure students graduate prepared to manage health needs, including populations at risk for poor physical health or low health literacy. such as those with disabilities. Presently little is known about the physical health, status health, literacy, or approaches to address their topics in school environments for youth with high incidence disabilities. The purpose of this study was conduct a comprehensive review of the literature from 1994 to 2014 to understand the physical health status and health literacy of youth with learning disabilities and emotional disturbance, as well as identify approaches to address these topics in school environments. A two-phase systematic process was used to examine the literature in respective topic. This included identifying search parameters and electronic database search, ancestor search, and coding of relevant articles. This initial search yielded with 130 articles. After coding 11 articles, remained, 8 focused on physical health status, 2 on health literacy, and 1 on intervention related to health literacy. Adolescent mental health has implications for current and future well-being. While a link exists between poverty and mental health, little is known about how experiencing material hardship, such as insecurity of food, housing, utilities, and medical care, throughout early childhood affects adolescents' mental health. We examined the relationship between material hardship in childhood and adolescent mental health. We used Poisson regression to examine the effect of material hardship experienced at different stages of childhood on adolescent depression and anxiety outcomes at age 15. We find that recently experiencing material hardship during childhood is positively and significantly associated with anxiety and depression symptoms at age 15, even when controlling for material hardship at age 15. Additionally, we find that insecurity during mid-childhood and the stress of lacking basic needs during a critical age may influence mental health in adolescents. People with intellectual disability experience poor oral health and are at greater risk of dental decay and periodontal diseases. This impacts on their general health and well-being. This review summarizes the research literature about oral health status and contributing factors to poor oral health. Method: we conducted a literature review using intellectual disability and oral health as our two course areas of focus. This is the results. People with intellectual disability had poorer oral health, greater numbers of tooth extractions, more caries, fewer fillings, greater gingival inflammation, greater rates of edentulism, and had less preventative dysentery and poorer access to services when compared to the general population. Anxiety during dental procedures was a key issue for females with intellectual disability. Conclusions: further research is needed to identify, pilot, and test appropriate and effective intervention that can reduce this preventable health disparity. The design of an ES-specific dental anxiety scale is another priority.
Good day, my name is Jason Ricardo R. Castillo and I am here to present the Chapter 3, which is the methodology of our research. So, research design. In this study, a qualitative exploratory design was used, allowing the researchers to get an in-depth understanding about the effects of early pregnancy problems faced by the healthcare system. Qualitative research has the advantage of uncovering the experiences of healthcare workers by enabling them to interpret and attribute meaning of or to their experiences and in the process construct their worlds. Respondents of the study. Respondents of the study are the healthcare workers of Mambabanga Luna. There were a number of 3 healthcare workers in Mambabanga Luna who volunteered and provided time to participate in this study. Research instrument. The primary tools used in gathering data was in a form of one-on-one interview with the respondents. The interview was focused on the challenges, coping strategies, and realization. Sampling procedure. In this study, the researcher used purposive sampling in which the researcher chose only workers and personnel who are working in the healthcare center and are residents of Luna. Data gathering procedure. Prior to data gathering, the researcher prepared an informed consent letter to the given or to be given to the respondents of the study. Voluntary participation was highly emphasized in the letter of consent. The data gathering procedure was done in a form of one-on-one interview which the researcher took written notes. All interviews were tape recorded. The interviews were informal and open-ended and carried out in a conversational style. So here are the profile of respondents. So respondent 1, Mina, 32 year of age, and healthcare workers. Respondent 2, Adeline, 25 years of age, healthcare workers. And respondent 3, Josepina, 29 years of age, and also a healthcare workers. Experiences of healthcare workers. So one is work overload. The participants praised that they had a lot of patients in combination with few nurses. This was uttered to affect not only stress in the nurses but affect the quality of care that they would give to the patients. The nurses stressed to have the time to handle the patients given to them and still they work overtime. Because of the handover they must give the next nurses coming in. Most of the participants uttered that they work maybe 2 hours overtime in an ordinary work day. The 3 shifts make you work overtime because you have to stay over to do the endorsement for the next shift. You don't have time to endorse before the shift ends, Mina said. Breaks is something that the participants found difficult to take because of the influx of patients and lack of staff. The breaks could be 1, 2 minutes or an hour depending on the situation that day. But when they get time to have a break, they have to stay in the hospital or even in the work because it is the sense of duty not to leave when many patients need to be taken care of. You will stay in the hospital, it is a sense of duty, so many patients to go over. So according it to Adeline, 25. Demanding or rather aggressive relatives can stress the nurses and affect their health when there is nothing more they can do for the patient. The nurses are being affected both physical and emotional to this situation, and situation becomes unhealthy for the nurses. So according to Josepina, there are situations within the care you give to the patients such as not being able to help them anymore. Not being able to help them affects your health mentally, emotionally, and physically. Coping strategies. Healthcare workers often think of the needs of others before their own. As valiant and admirable as that may appear at first, it often creates a situation in which these highly skilled, much needed healthcare workers hit the wall and render themselves ineffective. According to Mina, if you're a healthcare worker, it is absolutely mission critical that you take time to care for yourself and your family and other loved ones while dealing with the teenage pregnancy crisis, according to Adeline. So according to Josepina, her coping is working hard and praying. factors that help them. For Mina, her biggest factor that helped her cope being a healthcare worker is her husband. So for Adeline, its cooperation and understanding of her clients are the big factors that help her. And for Josephine, she views her mother as the biggest factor that has helped her. Advice to the teenage mothers. As for Mina, adolescents should be learned that being a healthcare worker is not easy but challenging. She also learned that as a worker, she need to learn to set her priorities, and she learned that one should grab the opportunity to learn and study. Adeline, learn that one should not be careless in choosing partners and achieve your goals despite having a child. And for Josephine, learn that you should not panic and should be knowledgeable of the consequences of your actions. So that's all. Thank you.